Okay. Okay. Well, hello everybody. This is Healthy Joints, Healthy Lifestyle Show with Dr. Arinola Dada, and we have an amazing guest today. She is another rheumatologist, Dr. Isabelle Amigues, who is a rheumatologist based in Denver, Colorado, where she sees patients. And you are going to be really much more filled up with very interesting information that's going to help you to a healthier version of yourself after this interview. So please listen, because I'm going to be here taking notes too, because different doctors have different approaches, and there's always a lot to learn when you talk to Isabelle. And so for those who don't know me, I'm also a rheumatologist in the greater Seattle area. I help people with joint pain and autoimmune diseases get their immune system back on track and become pain-free. So, Dr. Isabelle, I'm going to let you introduce yourself because you are just amazing.
Well, thank you so much, Dr. Dada. Such a pleasure to do this with you. So yeah, I'm Dr. Amigues. I'm French. I cannot hide it. And I did my training in France. And then I really like training. So I did it again all over in the US, in New York City. And I did a second fellowship at Columbia University in New York City. And I am loving research. So I've done a lot of research. I'm very evidence-based medicine, but because I myself became a patient at the age of 40 and developed stage 4 breast cancer, I actually discovered the power of a holistic approach to health, where it's not just medication, but it's also a lot of empowering techniques for the patient. And so I started on this rabbit hole of first of all, like discovering all of those techniques for me, and then looking at studies behind all of those techniques for my patients. And I was pretty blown away when I realized that a lot of techniques are actually proven by science to be efficient for our patients. So it's really a pleasure. And just so that everyone knows, I have a direct care / concierge rheumatology practice in Denver, Colorado. And I'm very passionate about offering the best care ever to patients. I think that's the most important thing that we can do for our patients. And so I've decided to not take insurance because I want to give the best of me to my patients. And that's what I have started about 4 or 5 years ago, months ago. And so far, it's been just a phenomenal first 5 months where I just see the difference in my patient's life, and I love it. I just love it. And I think they love it too. So yeah, this is me.
Okay, wonderful. Actually, I am very excited to talk to you about even just the power of the holistic approach. And so I think we'll delve back into that. But, some patients are not necessarily very familiar with direct patient care. Can we talk about that just a little bit so that, your ideal patient is out there and doesn't really understand this? Maybe we can break it down for them a little bit.
Yeah, absolutely. Well, thank you so much for asking. So I think the issue is the healthcare in the US, and insurances are here to make money. And while I think that pharmaceutical companies actually have something to add to our patients' life because they create drugs that are very powerful, and they do want to make money so that they can create the next drug, I think that insurances are here to deny everything. And they do it from different perspectives, but one of them is that as a physician, you have to discuss how much you're going to get paid sometime every 4 months, sometime every 6 months, sometime every year. And I just didn't want to have to discuss how much I was going to get paid with insurance. And one of the things that I discovered as a patient was when I had to change insurance because suddenly my employer decided that the insurance we had was too expensive, I lost my doctor. And I just don't want my patients to have to go through this. I think that if you have a connection with a doctor, that's wonderful. You should keep that doctor. And I don't think that doctors are interchangeable. I think that you create a long-lasting relationship with your doc. And that is, to me, almost a sacred relationship because it's a healing relationship. And so I just didn't want to have insurance. And my patients, so what they do is that they actually get they're out of network to pay for. Basically it's a cash pay, like you could call it a cash pay practice, but basically I'm also like, the reason why it's direct care is that there is no middleman between me and my patient. I still work to get the prior authorization for medication and so on, but I have much better deal on labs, x-rays, and I have a relationship with my patient, and so we discuss, and I'm theirs. Like whenever they need me, they have my cell phone, they have my email, they have every single, they can reach me anytime, so that
access.
they know. Yeah, and that's what it is. It's really just this care that's, for me, reminded me of how we were taken care of when I was little in France. And this is what I wanted to create and what I'm creating, and I love it.
Well, you know what? I just admire your passion. I just admire the way that you are able to create this. It's a lot of work that goes into the back end of this, but your passion just kind of shines through, and how you want to help your patients. So thank you for really explaining that. And I think that a lot of patients would actually resonate with them. So yeah, thank you. Okay, so let's delve into just a simple question of, why did you even want to become a rheumatologist? What was it about rheumatologists that even made you, do it once, not once, but twice? You ended up doing it all over again. What was it?
And I definitely did it twice. I love it. There is a combination of different things. I think the number one is that it's chronic, in the sense of you create a relationship with a patient, and it's not like the emergency room or the intensive care unit where you see the patient one time or twice and then that's it. Like I could not become an ICU doc. I could not become an internist, just because you don't get to see your patients afterwards. And I really love my patients, and they become part of my family. I want to know what's going on in their life, and I have no problem sharing my own life with them. It's really this trusted relationship. So that was like the number one. The number two is that it is a fascinating topic, right? Like, we are talking autoimmune. Everything is rheumatologic now. We're talking autoimmune. We're talking like, why is it that the immune system decides to overreact and cause all of this inflammation in our body? So I'm fascinated by that. I think it's so interesting, and really like the art of finding the right treatment that's like the least amount of immunosuppression for our patient. I think is a really interesting thing. So when I was doing research, and I'm still doing research, but a bit less, I love doing research in rheumatology because I felt that it was really touching upon some fascinating topics of immunology and inflammation. So that's like number two. Number three is that I like being a doctor that gets my patients better. And there is no other specialty that does that. I mean, it's incredible. I started rheumatology when the TNF inhibitor started, and I started seeing patients that were crippled suddenly becoming fully functional. And it's only been getting better and better every year. And I love seeing my patients doing better. And I always tell them we're aiming for remission with treatment, maybe, but still remission. And so that is my goal for my patient, is to get to remission so that they can live the lives that they were meant to live. And that's like the third one. But there's so many reasons, but like I am never bored in rheumatology. It's just like such a cool specialty. All of the reasons.
I think I think you're going to get total agreement on this end, and I think that's something that's common probably to our generation of rheumatologists, and probably why a lot of us went into rheumatology, is that is when the biologics came out, and that is when we saw that dramatic change, where people who previously were just, it was a lot of hand holding is what I called it, and you have to talk about everything but the pain you're experiencing with your doctor. And when these medications came along, they were just revolutionary. So I totally resonate. I think with a lot of rheumatologists as kind of just that like light switch that, oh my God, this is where we can make an impact in people's lives. So, but you mentioned something about research, and I do know that you've had some experience, a lot of experience with research in rheumatoid arthritis.
Yeah, I love it.
Do you have a case of kind of, I think, maybe just an interesting case of a
I
patient
do.
that you've seen that you'd want to share, and maybe somebody with rheumatoid arthritis, maybe, so that we
Oh
can
no,
kind of
I
link
have
your
many
experience?
cases, but I have many cases, but I'm gonna. Well, actually, do you want a case first, or do you want to tell me about research first?
You know, I will take whichever. I will take research first, and then we'll do a case.
Okay, let's talk about research. I'm going to
Yeah.
share one of my favorite studies that I was the
Okay.
first author on. So I was really involved. So we looked, it was at Columbia University, and we looked at the heart of patients with rheumatoid arthritis. So
Yeah.
patients with rheumatoid arthritis have more chance of having heart failure, heart dysfunction, and so on, and cardiovascular disease. And so the thought was, why is it that patients with rheumatoid arthritis have more risk of heart issues? And very brilliantly, my mentor, Dr. Baton, was like, well, maybe it's because there is inflammation also in the heart. How do you
Yeah.
look for inflammation in the heart? Well, it turns out you can do MRI that lets you to look at the inflammation. You can also do PET scan. I love PET scan. I think that are such a cool way to look at the system. And just for background for patients, it's actually very easy. You basically take glucose, and glucose is literally like anything that you're eating is going to go to glucose, because glucose is what you use as an energy. So imagine like fuel, like, you know, when you put gas into your car,
Mhm.
that's glucose,
Yeah.
right? Like imagine that you're
Yeah.
putting glucose, and um, you mark the glucose, and then you take a picture of the body, and in this case the heart, but you can do it for the
Yeah.
whole body. And what you're going to pick up is the inflammation, because inflammation is basically what's happening when you have inflammation is that the organs pick up more, like they act more, they
Yeah.
are working more.
Yeah.
And so you're basically looking at this glucose that has been marked, and then you can do pictures. And so
Yeah.
you can use a PET scan for cancer, infection, inflammation. And in rheumatology, we love it for vasculitis, which is inflammation of the
Yeah.
vessel. We love it
Yeah.
for inflammation of the heart. And so that's what we
Definitely.
did. We looked at the heart of patients with rheumatoid arthritis.
Yeah.
But mind you, that none of those patients had cardiovascular disease. So we were
Right.
looking at the heart saying, okay, we want to look at the heart of our patients with rheumatoid arthritis,
Yeah.
knowing that they don't have any cardiovascular disease.
Yeah.
Well, a lot of them had inflammation of the heart. And
Yeah.
it doesn't stop here. With treatment, we did a very small study looking at before and after treatment, so TNF inhibitor in this case. So with treatment and triple therapy, we saw that they were decreasing their inflammation of the heart.
Okay.
And so then it comes down to, when you're treating your rheumatoid arthritis, you're not just treating your joint, you're treating
Yeah.
every single
System.
inflamed organ in your body,
Yeah.
including the heart and including the vessels. And so that is my favorite study, because I think there is it's like very often in research, you don't really see right away the endpoint. Like you're not
Yeah.
seeing like, oh, is it actually going to make a difference in my patient's life?
Yeah.
And in this case,
Yeah.
I'm like, holy cow, this is really making a difference,
Yeah.
because we
Yeah.
have not just a proof of concept, we have
Yeah.
the proof that what we've been thinking this whole time is true. There is
Yeah.
inflammation and not just the joint. So
Yeah.
yeah, make sure that you go into
And
full remission with treatment.
yeah, yeah. And
So that's
I
the
think,
research.
yeah, that's perfect. And I think it also helps. Sometimes people feel like, oh, I'm doing well. I feel a little stiff, but maybe I don't need to be on the medicine anymore. And think understanding that it's not just your joints, there's inflammation all over, and using some of these medications at the right amount for each person, which is why we have the rheumatologist to kind of make sure that they're being
Yeah.
treated with just the right amount of medication, is very helpful to make sure that even the inflammation around the heart actually gets suppressed, and so that we don't run the risk of developing cardiovascular disease. So medications are doing more than just treating the joints. So thank you. That's actually very helpful, and I think very helpful for our patients to understand when we're saying systemic inflammation, we actually have proof that actually the medications do help. So that's
Yes.
amazing. So now we want to go through the patient.
Oh
An
man.
example of like a patient that you've treated that had,
Yes.
an interesting outcome that you
Oh
would like to
yes.
share.
I have many, but since I've been talking about holistic medicine, at least partially,
Yeah,
right? Um,
yeah,
I'm going to talk about one of my favorite because it's just so obvious, but I have so many cases. Um, sorry, I have no. Actually, I'm not going to talk about my favorite. I'm going to talk about this other one because I thought it was really cool. So I had a
okay.
patient with interstitial lung disease,
Mm,
very severe, like MDA5. So she needed oxygen, and she had MDA5. So that's an antibody that's usually associated with more severe lung disease.
mm, mm,
And she had Medicare, and for some very strange reason, the treatment took for a very long time to be approved. I still don't understand what happened. Like, this was not in the current practice I have, it's the previous
yeah,
practice I was in.
yeah,
And but when I had met her, I had told her, well, look, we're gonna, do a lot of immunosuppressive therapy because we want to make sure that, this reverses. And we're
yeah,
gonna do, like all of those immunosuppressive therapy. But in
yeah,
addition, there are things that you can do. And all of those are actually proven by science. And
yeah,
so basically, just talking about it, right? I told her about meditation. I told her about visualization, diet. I told her about exercise, and journaling and changing your diet, right? And so I come back. I mean, she comes back 3 months later for a follow-up appointment because I couldn't get her in before. And I start looking at her chart and I'm like, holy cow, she hasn't received any of the medication I recommended. Again, because of issues with the insurances and that I had not heard about. And basically I go to her room and I'm like, wow, I get on me like to think, okay, I might have to hospitalize this patient, or I might have to, do something for this patient. Like maybe she's in a really bad shape. I opened the door and I'm seeing her like with a huge smile on her face. And I was like, what happened? Did you get your medication? Like, she's like, no, but I've never felt this good in 20 years. And I'm like, what
wow,
happened? She's like, well, I started doing all of the things you told me, but really what has changed my life is the new diet you told me, which is, just an
wow.
anti-inflammatory diet, like nothing, no big
Mhm.
deal. I mean, no big deal. You have to follow it. But
You have to
and I
follow
was
it.
like,
Yeah, that's where it
what?
becomes a big deal. Wow.
Yeah. And I'm like, what? She had not gotten the medication, nothing. And she was
Interesting.
doing better. So her lungs were
Wow.
stable, they were the same. We still
Yeah,
needed to do the immunosuppression therapy and all this, and we did, right?
yeah,
Like, I'm
yeah,
still Western medicine.
yeah,
So I
yeah,
think you need to do both, but
yeah,
super
definitely.
impressive. I mean, very, very impressive. In 3 months, she had not gotten worse.
That's
And
amazing.
exactly. And this makes me think, this made me think, don't underestimate the power of other techniques in our patients'
Yeah,
lives.
yeah,
And it
definitely.
might be meditation for one. Another one, it was she had affirmation. She was listening to affirmation
Yeah,
and visualizing, and she
okay.
felt better than she had ever felt with her rheumatoid arthritis.
Yeah.
And
Mm-hmm.
so I think that this is one of the history. I have so many. Again, I love
Yeah,
rheumatology. There's a reason I love
yeah,
rheumatology. I
yeah,
have like plenty. I have like a chicken soup for the rheumatologist, with so many good stories. But
yeah,
that's one of the ones that are coming to my mind because it's just like, sometimes you try to do all, and then maybe one of the thing is going to be the one thing for you that's going to change
yeah,
your life. Maybe you're doing
yeah,
all of them, but this is the one thing that you're doing to change your life, and that
yeah.
is wonderful. So yeah.
I think that's, yeah, thank you for sharing that story. I think that's actually very moving. And I think hopefully it also helps our patients because I think honestly, some people may find that actually changing the diet is actually a very difficult thing to stick to, right? There's just the, fast food, ain't got time, those kind of things. So actually hearing stories like this, where a patient was able to dramatically alter the progression of her autoimmune disease by doing the affirmations, doing the diet and doing the meditation, where she's actually involving her brain in controlling her immune system, basically, is what she was doing, and also helping the body and making sure she's feeding it with things that are nutritious and not things that will aggravate the immune system. So yeah, I think it's always very helpful to hear stories like that, because I think they motivate our patients to kind of continue, because it's not a light switch, it's just basically moving your tracks in the other direction, other than kind of what your immune system was trying to do. So thank you for sharing that, because I think those stories really make a difference. Hold on a second. I'm not sure how we got. Going to do this.
We have a guest. Woohoo! Hi, Dr.
I think we're on pause. Okay. And then can you sign out? Sign out.
Bye.
Okay, good. I paused it so we can continue. Next time, I think I'm going to ask for permission for people to come in. But anyway, we can always. So we're on pause anyway, so we can. Pause it out. Okay. So anyway, back to what we were saying. So guys, you're gonna have to edit that part out. Okay. So so I think we just spoke about kind of the example that you gave on the patient who dramatically got better, at least stopped progression. So so thank you so much for sharing that. And so I think my next question is more my fun question. Is if you had a superpower, what superpower would you wish you had and why?
Wow, that's such a good one. If I had a superpower, I'd like it to be to control my mind, because I think that mind can be both really really powerful, but also very hurtful. And so, for example, when you have fear, when you have stress, when you have anxiety, it can really be really painful, and it doesn't heal. And I think that that would be my superpower. And the reason I'm not telling you about a superpower about medical practices is that I actually really think that we have really incredible drugs, and that the power of the relationship with the patient is so strong that, to me, I already have that. And so patients are really lucky. But I think all of us, we need to work with our own superpower to quiet our minds sometimes, to relax us and to tell us everything is okay. There's no reason to stress, no reason to fear. Fine. Like we forget how powerful we can be. So that would be my superpower. I think it's a very hard one to get.
No, and I think that's something that we all have, right? That we wrestle with, you know. And so yeah, thank you for sharing that. Actually, that's, you know, I love that question, because I always get totally different answers, and every answer is kind of unique. And this actually, I think, is an amazing answer, actually. Yeah, I think that's actually a good, and maybe actually one of the best superpowers to get. If you have total control of your mind, and then different situations come, you can control that, minimize anxiety, stress, probably will sleep better, and have your immune system better too. So wow, so thank you. This has been actually a very insightful interview, and I really appreciate you coming on. So can you tell our guests where to find you?
Yes, absolutely. So my practice is called UnabridgedMD in rheumatology. The idea is to say that it's a whole you, non-edited version of the doc and non-edited version of the patient. So it's the whole patient and the whole doctor. And so it's UnabridgedMD.com, and I'm in Denver, Colorado, and I see patients in Denver in person, but I also do telehealth for Colorado, Wisconsin, and Michigan right now. And I might add Minnesota.
Helpful.
Yeah, thank you.
So perfect. So yeah, so and we're also going to have kind of the information at the end of our video when this goes live. So my name is Dr. Arinola again, Dada, and Overlake Arthritis Osteoporosis is our clinic in the Greater Northwest area. Appreciate you listening to us. If you like this video, share it. Follow us on our YouTube channel, and we'll definitely be bringing you more of this every week. Thank you so much, Dr. Isabelle, for coming up to the show. Really
Thank
enjoyed it.
you.
Talk to you soon.